Okay, the first aid box is what you're going to need to bring with you on skateboard. You're going to have to label it first aid. Inside of your first aid box, you will have several pairs of gloves. Two is fine. Two pairs of gloves is fine. Your styptic liquid, green or blue is fine. You're going to have your hand sanitizer, two Ziploc bags labeled blood contaminated material. Blood contaminated material, two of those. Also, you're going to add in alcohol prep pads. Two of them is fine. Eventually, you'll have more extras. All right, two Band-Aids and gauze. Like I mentioned, I do have some extras in here, some extra gauze, some Purell wipes, alcohol wipes, extra Band-Aids, because I do use this as my first aid kit for when I'm taking clients. All right, you just always want to have this with you. All right, and a pencil case labeled first aid. All right, so we're going to get into the demo. So these are the steps you will follow if your client was to sustain minor injury that does not prevent further service. All right, so we're going to sanitize our hands first and foremost, always. And then we're going to place a pair of gloves on. Remember, for state board, you are not required to do this portion of the exam. It has been eliminated. However, if you do accidentally cut yourself on the exam, you will be required to follow these steps and follow them exactly. And they will be deducting points if you do not follow these steps in accordance to the blood contamination guidelines. All right, so we're going to use this pointer finger here. We're going to act as if this finger has a cut on it. And cuts can happen with files, nippers, just a minor cut. Especially when you're just starting, it does happen kind of frequently. You might just accidentally nick a client, so it's good to know these steps. All right, first thing you're going to do is open up a gauze. And you're going to apply pressure with the gauze to the wound to help to stop the bleeding. So just apply pressure to help with that bleeding. You're going to take that gauze that has been contaminated with blood, and you're going to place that into your blood contaminated material Ziploc bag. You're also going to throw out the wrappers with it as well. Anything associated with this procedure, you're going to put it in that bag. Next, you're going to use your alcohol prep pad. Open that up. And we're going to go ahead and wipe down the wound. Clean it off really well. Okay. Then I'm going to wrap that up and place that, including the wrapper, inside the blood contaminated materials bag. Okay, now we are going to apply our styptic liquid. 1 drop is fine, and always be sure to never have the nozzle touch the client's skin at all. We don't want any contamination, cross-contamination. So, and that goes with any and all of your dropper, nozzles, any type of products that you're using for nail services. All right, we're going to go ahead, open one of our bandages, and we're going to place that on our client. Okay, wrap that with that on your client's finger. Now, in the real world, this is for state board. However, in the real world, if this was to happen, this step would be sufficient. If you were going to continue the service, you would not need to apply the bandage. All right, at this point, the finger should stop bleeding. All right, if the cut is a little deeper, you're going to want to apply the bandage. But if it's a small nick, you can just follow every step and do not place the bandage on. All right, and that's it. All right, so now we're going to do the removal process of the bandage. Sometimes if a client is bleeding profusely, you will have to put a bandage on, service the other fingers, and then come back to that finger until you see that it stops bleeding. So you might need a bandage in moments like that. All right, so we're going to remove the bandage. All right, and then we're going to dispose of it. Remove your gloves in a hygienic fashion. All right. One side to one side. And then you're going to dispose also of the paper towel or dental bib that you have underneath. All of that goes into your blood contaminated materials bag. This bag is then sealed and then placed in your trash. Okay. Afterwards, you will sanitize your hands once more after you remove those gloves. All right, and that's the final step in the blood contaminated materials and blood exposure portion of the exam.